What is safer for diabetes, insulin or pills? Somebody asked me this question. There's a part of video series called Your Question, My Answer. So let's break this down scientifically and practically. First, understand type of diabetes. There are two types of diabetes. Type 1, the pancreas does not produce insulin. In this case, insulin is not optional. It's life-saving. Without insulin, blood sugar becomes dangerously high. And so for type 1, insulin is not just safe, it is essential. Type 2 diabetes, that's different. Yeah, the body still makes insulin, but the body becomes resistant to it. Over time, pancreas may get tired and produce less insulin and then may stop. And that's called type 1.5 diabetes. And this is where the pills are often started first. Step 2 is the question about, are diabetes pills safer? Now, let's look at the common pills and then we're going to put into the right picture. We have metformin, then we have SGLT2 inhibitors like Jardians, then DPP4 inhibitors, then you have sulfonylureas like glipizide, glyburide. What is the advantage of pills? Easy to take, no injection, cheaper, some even cause weight loss, some protect the heart and kidney, low risk for low sugar depending on the class. For early type 2 diabetes, pills are often very effective and appropriate. Now, is insulin dangerous? Many people fear insulin, but here's the medical truth. Insulin is a natural hormone your body already makes. When prescribed correctly, it is safe, effective, and it can prevent complication. However, insulin does pose a risk. It can cause low blood sugar if overdosed and if you skip your meals. It can cause possible weight gain and requires monitoring. But these risks are manageable with proper medical supervision. It does require commitment and discipline. Okay, what is insulin? When is actually insulin a safer choice? Insulin may be safer if A1C is running very high despite taking sufficient amount of oral medication like A1C above 9 or 10%. And if the blood sugars are persistently high, more than 250, during serious infection, during surgery, kidney failure, limits pill options. If there's a long-standing diabetes with pancreatic burnout. In these cases, trying to avoid insulin may actually be more dangerous. And so what actually determines safety? Safety depends upon your A1C level, kidney function, history of heart disease, history of hypoglycemia, weight status, and duration of diabetes. There's no universal safer medication. Safest treatment is one that controls blood sugar, minimizes hypoglycemia, protects your organ, and matches your health profile. So insulin is not a punishment. Pills are not automatically safer. Diabetes treatment must be individualized. All these factors must be taken into account. And remember, uncontrolled diabetes is more dangerous than either insulin or pill. So the important question to ask is, what is safest in my situation? That is the correct medical question. The other person asked me, other follower of mine asked me, which is safer? So it depends upon your situation because treatment of diabetes is individualized. If you found this helpful, comment below, ask questions. Are you on insulin or pills or both? What's your latest A1C? I'll try to guide you. I'm not your doctor, but this is just for educational purposes. I'm here to help and educate you guys. I'm Dr. PK. Stay informed and stay healthy.